How effective is surgery for different types of hearing loss? Imagine being able to hear again clearly after years of struggle. Surgery can be a powerful tool for some types of hearing loss, but how well does it work? The answer depends on what kind of hearing loss someone has and what's causing it. Let's explore the main types and what surgery can do for each. First, there is conductive hearing loss. This happens when sound waves can't reach the inner ear properly because of issues in the outer or middle ear. Common causes include a damaged eardrum, problems with the tiny bones in the middle ear, or blockages like earwax or infections. Surgery is often very effective here. For example, a stapedectomy replaces the stapes bone in the middle ear, which is often used for otosclerosis. This procedure can significantly improve hearing by restoring sound conduction. Other surgeries might repair a perforated eardrum, remove middle ear tumors, or clear blockages. Bone-anchored hearing systems are implants that transmit sound through bone conduction, bypassing damaged parts. These are especially helpful when traditional hearing aids don't work well. Overall, surgical treatments for conductive hearing loss can restore or greatly improve hearing in many cases. Next is sensorineural hearing loss, which is the most common type. It results from damage to the inner ear or the auditory nerve. This damage can be caused by aging, noise exposure, genetics, or certain illnesses. Unlike conductive loss, surgery cannot fix the damaged sensory cells or nerve pathways directly. However, there are surgical options to bypass the inner ear damage. Cochlear implants are the main example. These devices are surgically placed and convert sound into electrical signals that directly stimulate the auditory nerve. They do not restore normal hearing but can provide a significant improvement in understanding speech and environmental sounds for people with severe or profound sensorineural loss. For mild or moderate loss, hearing aids are usually the first choice. So, surgery for sensorineural loss mainly involves cochlear implants, which can be life-changing for many users. Then there is mixed hearing loss, which combines both conductive and sensorineural issues. Treatment here often involves a combination of surgical and non-surgical approaches. Surgery can fix the conductive part, like repairing middle ear problems, while hearing aids or cochlear implants address the sensorineural component. The success of surgery depends on how much each part contributes to the overall loss and the individual's specific condition. Lastly, there is auditory neuropathy spectrum disorder, or ANSD. This condition involves problems with how sound signals are transmitted from the inner ear to the brain. Even if the ear detects sound normally, the nerve signals may not be processed correctly. Surgery is generally not effective for ANSD because the issue is not with the mechanical parts of the ear but with nerve signal transmission. Management usually involves hearing aids, cochlear implants, or other assistive devices tailored to the person's needs. In summary, surgery tends to work best for conductive hearing loss, often restoring hearing by fixing or replacing damaged middle ear structures. For sensorineural loss, surgery like cochlear implants can greatly improve hearing in severe cases but does not restore natural hearing. Mixed loss may benefit from a combined approach, and for nerve-related issues like ANSD, surgery is usually not helpful. Because each person's hearing loss is unique, it's essential to consult with ear, nose, and throat specialists and audiologists. They can evaluate the specific cause and severity of hearing loss and recommend the most appropriate treatment plan. Always seek personalized advice from qualified healthcare professionals to find the best solution for your hearing health.